My basic philosophy in shoulder surgery is more of a conservative approach. Most patients that come to see us are desiring surgery. Not all of the patients that come to see us want surgery. That's an important key distinction. One of the first questions I always ask all of my patients is, how can I help you today? And what I'm trying to elicit with that question is this a problem that's been affecting this person for quite some time? They've exhausted all forms of reasonable conservative treatment, and the last resort is a surgical treatment. That may be the case. But there are occasions where I see patients and I ask that question and they don't want surgery. Being familiar with the way to treat a shoulder condition non-operatively, knowing how that shoulder condition will respond to non-operative treatment is essential because some patients prefer that. My goal and our team's goal is to make sure that we provide everything we can to make that process run smoothly and efficiently. In order to do that, it requires effective communication. It requires participation on behalf of the patient. It requires participation on behalf of my office staff and our nursing staff. All of those things are easily accomplishable. It's more than just listening to their heart and lungs or examining the strength of their arm. It's knowing who they are as a person. The ability to understand where a person's from, where they're coming from with respect to what condition they have, how it affects their life, how it impacts their work, how it might affect their family. Understanding those key attributes is so paramount in being able to provide the appropriate care for your patient. I personally believe that empowering the patients in their own care is essential to success. My job as a physician is to make sure they understand what I'm doing from a surgical standpoint and what our goals are so that they have the ability to actually meet those goals. If you can identify the source of someone's pain, and if the source of that pain is a mechanical problem, then oftentimes science and innovation and surgeons can oftentimes think of a mechanical solution to help correct that problem. The shoulder, as we think of it, is really a ball and socket joint. It's so true with the shoulder joint as it is with many other joints that if you can find the source of the mechanical problem that's causing a patient's pain, their stiffness, their instability, or their weakness, and you can identify that, there's no question in my mind that science and innovation will come up with a technique to help address that. And my goal is to make sure they know exactly what their mechanical problem is with their shoulder, what the mechanical solution is with the shoulder, and how we're going to get to that end result where they're back in the game doing the things that they enjoy. I'm really excited to join the Shoulder Clinic of Idaho because I believe that organization represents the best there is for shoulder care in the state of Idaho and the surrounding region, and I'm hopeful that with my experience and my background and training that I can make a meaningful impact both on that group of providers but also more importantly the patients that come to see us.